Welcome to the body scan. As best you can, bringing gentleness and a kindly investigative curiosity to this practice of the body scan, we'll be cultivating the ability to move our attention throughout the body, narrowing and widening the focus at times, simply being present to what is here right now. It's important to remember not to try too hard to relax when doing this meditation, striving to be in a state of mind and body other than what is here simply creates tension. Allow yourself to simply become aware in each moment of what is here right now and accepting what is happening in yourself, looking at it clearly and seeing it as it is because it's already here and part of your experience. Allow yourself to be exactly as you are. Using the instructions for guidance as best you can, watching your body and the activity of your mind as we go along, letting go of judgmental and critical thoughts, allowing them to come and go, neither getting caught up in those thoughts or pushing them away, simply noticing with gentle curiosity thoughts and emotions as they come and go, as well as whatever may be here. As best you can, being aware of how you're feeling, of what is happening in the body, being gentle with yourself, remembering that there is no right way to feel or wrong way to feel. You're simply feeling what you are feeling right now. Do the body scan meditation in whatever posture or position that feels best for you. If you find that lying on your back is not comfortable, adjust your position. It's really your compassionate sensitivity and level of attention which is important, and not the way you are lying or sitting. Just allowing the breath, the body, and your experience to be what it is, while noticing what's present for you in this moment. There's no need to change your breath in any way. No need to count. No special rhythm. Just allow the breath to breathe naturally, noticing the abdomen rising and falling. Observing the breath one after another. And now, gently allowing the eyes to close if that feels comfortable for you. If not, allowing the eyes to remain slightly open. Allowing the gaze to be soft and unfocused. And letting the arms lay comfortably at the sides of the body, palms facing up or down, whichever feels most comfortable for you. And gently allowing the feet to fall away from one another. And bringing awareness to the entirety of the body, from the head to the feet. The entire back of the body, points making physical contact on the mat. And noticing the entire front of the body. And returning attention now to the abdomen. And bringing awareness to the sensations of breathing, the rising and the falling. With each incoming breath and each outgoing breath, following rhythmically one after the other. Bringing a kind and gentle curiosity to the sensations of breathing on the inhalation and the exhalation, observing the rising and the falling of the abdomen. And if you notice that the mind has wandered off into the train of thought, gently recognizing where the attention has gone, and then the choice to bring awareness back to the sensations of the breath, noticing the abdomen rising and falling. And on the next breath, moving the focus of attention away from the abdomen and down the left leg all the way to the left foot, and noticing the big toe of the left foot, the pad of the big toe of the left foot, and becoming aware of the sensations present here and around the big toe, the bones of the toe, the tendons, ligaments, the top of the toe, the nail of the toe. And now bringing attention to the other toes of the left foot, and noticing what is present here, observing any sensations of tingling, moisture, itchiness, warmth, feeling the toes as they are. And if you sense there are no sensations, then just experiencing that. And on your next in-breath, bringing attention to the bottom of the left foot, observing the arch of the left foot, into the heel of the left foot, and then shifting attention now to the sides of the left foot, coming up to the top of the left foot, bringing awareness to any sensations in and around deep inside the left foot. And then breathing out and releasing attention from the foot. Breathing in with awareness to the left ankle. Observing any sensations in and around the left ankle from the skin and deep inside the bones. Then breathing out and releasing attention from the ankle. Breathing in and moving attention now to the left lower leg, to the area above the left ankle, below the left knee. Noticing any sensations in and around the top of the shin, the sides of the calf, the bottom of the calf. Noticing any sensations in the muscles or inside with the bones. Any sensations around the lower left leg. And breathing out and releasing attention now from the lower leg. And shifting attention up to the left knee. Up the patella tendon and to the kneecap, the top of the knee. Circling attention around the top of the knee, in the sides of the knee. Bringing awareness now to the bottom of the knee. Noticing any lightness or heaviness. If you're experiencing no sensations, then just experiencing the knee as it is. Remembering there's no right or wrong way to feel. And if you've noticed that attention has wandered off to thoughts, future memories, simply returning attention gently back to the sensations of breathing, and then returning attention to the next instruction. And on the out-breath, releasing attention from the left knee, and breathing in and moving attention now to the upper left leg, and the top of the thigh of the upper left leg. And observing the quads of the left thigh and the sides of the thigh, the inside of the left thigh and the groin, and noticing the bottom of the left thigh, noticing any sensations with the thigh making contact with the mat. Breathing out and releasing attention from the left thigh. Breathing in and moving attention now to the left hip and the joint of the left hip. Observing any sensations in the area of the left hip. Experiencing the left hip as it is. And on the out breath, releasing attention from the left hip and breathing in and bringing awareness from the left hip over to the right hip. And moving attention down the right leg, down to the bottom of the foot, and to the right big toe. Noticing the sensations of the right big toe, the joint of the big toe, the pad of the big toe, the sides of the big toe, the top of the big toe. Observing any sensations with the nail of the big toe. Now breathing awareness to the other toes of the foot. Noticing any tingling, itchiness, moisture, or warmth. Experiencing the right toes of the right foot as they are. Not trying to change or feel anything. And if you're feeling no sensations, then just experiencing that. And on your next breath, placing your attention to the bottom of the right foot, the arch of the right foot. Moving your attention to the heel of the right foot. Observing sensations on the sides of the right foot. Breathing in and noticing the top of the right foot. Breathing in and sensing deep inside the right foot. Experiencing the right foot as it is. And on the out breath, releasing attention from the right foot and breathing in and moving your attention to the right ankle. Sensing the right ankle as it is. From the top of the skin, deep inside the right ankle, observing any sensations. The right ankle. Breathing out, releasing your attention from the right ankle. Breathing in and placing attention now to the right lower leg, to the area above the right ankle and below the right knee. Experiencing the right lower leg, the front, the shin of the right lower leg. Observing any sensations in the sides of the calf of the lower leg. Moving on down to the back of the calf. Observing sensations of the points of contact on the mat. Observing any lightness or heaviness. Bringing awareness to the inside of the right calf. And on the next breath, moving the focus of your attention to the right knee. Sensing the patellar tendon of the right knee, the cap of the knee, circling your attention around the top of the knee, and shifting awareness to the sides of the knee, down to the bottom of the right knee, noticing any lightness or heaviness, itchiness, numbness. Bringing awareness deep inside the right knee, experiencing the right knee as it is. And on your next breath, moving the focus of your attention to the right upper leg, to the top of the thigh, sensing the muscles of the thigh, the quadriceps. From the top of the thigh, moving awareness to the sides of the thigh, the inside of the right thigh, the groin area. Moving now to the bottom of the right thigh, and sensing any points of physical contact and sensations with the thigh, resting on the mat and floor. Allowing the right thigh to be as it is. And on your next breath, moving attention now to the right hip, to the joint of the right hip. The femur hits the pelvis, experiencing the right hip as it is. And on your next breath, moving the focus of your attention from the right hip across to the left hip and experiencing the sensations of the pelvis and the pelvic region, the organs of this area, the genitals, anus. For some, this is an area of great sensitivity, and if this is true for you, simply holding awareness here only as long as is right for you. Always giving yourself permission to adjust yourself as necessary. If you are experiencing any intense sensations, allowing the eyes to open if that is right for you. Allowing the gaze to be soft and unfocused. Returning to the sensations of the breath. Breathing in and out. When you are ready, returning to the next instruction. Breathing in and being present, allowing each moment to be as it is, without trying to change or manipulate the breath in any way. Just noticing the inhalation, the rising of the abdomen, and the exhalation, and the falling of the abdomen. And if the mind has wandered off into the train of thought, simply recognizing where the mind has gone, knowing that's what minds do, and gently returning attention to the sensations of the breath. And on the next in-breath, moving the focus of your attention now to the area of the buttocks, the tailbone, connecting to the spine, the lower back. Then moving attention to the abdominal region, noticing the rising and the falling of the abdomen, allowing the breath to breathe naturally as it is. And on the next breath, moving the focus of attention now to the middle of the back. From the waist to the bottom of the rib cage. Sensing the lower ribs. Expanding in and out as they protect the kidneys, the organs, the liver and spleen. And sensing how you feel the lower ribs in the spinal cord and the middle back. Observing the muscles on either side of the spine. Noticing the breath with each expansion and contraction. the rib cage, the back, following the ribs to the front. On the next breath, moving attention now to the upper back and the shoulder blades, perhaps noticing the physical contact on the mat, and then moving up to the back of the neck. And on the next in-breath, returning attention to the front of the body, the area of the stomach. Observing the diaphragm between the belly and the lungs. Moving attention to the heart and the chest. Observing the heart and lungs nourishing every region of the body. A continuous cycle of detoxification and purification. With the inhalation and the exhalation of the incoming breath and the outgoing breath. And on the next in-breath, moving awareness from the shoulder region down both arms, coming to the hands, noticing what position the hands are in. What are they making contact with? Is there an awareness of temperature, of dryness or moisture? Focusing attention on the fingertips of both hands. Becoming aware of the sensations of the tips of the fingers and the thumbs. Perhaps feeling some sensations of the blood flow, the pulsing, tingling, dampness or warmth. Just feeling the fingers as they are. The sides of them. The joints, the knuckles, the nails and the nail beds. Allowing the field of awareness to expand to include the palms of your hands and the backs of your hands. And on your next breath, returning the focus of your attention to both of the wrists, the joints of the wrists, the bones of the wrists, experiencing the wrists as they are, without trying to change the sensations in any way. On the next in-breath, moving attention now to the lower arms, noticing any sensations, the muscles and the bones. On the next breath, shifting attention now to the joint of the elbows, observing any sensations in the elbows connecting the upper and lower arms. And breathing in and moving attention now to the upper arms. From the elbows to the armpits. Experiencing the biceps, triceps, top, the sides of the arm. And breathing in and bringing awareness now to the shoulders. Noticing any tension that might be stored here. And breathing in and out and experiencing the sensations of the entirety of both arms. From the hands, the wrists, the lower arms, the elbows, the upper arms. Observing with each in-breath and each out-breath sensations of both arms. And breathing out and releasing attention from the arms. And on the next in-breath, returning your focus of attention to the neck and the throat. Perhaps noticing sensations of swallowing, tingling, itchiness. And on the next out breath, releasing attention now and returning the focus of your attention to the jaw, the chin, the lips of the mouth, perhaps noticing moisture, warmth or coolness, itchiness. Breathing in and shifting attention to the interior of the mouth, sensing sensations along the teeth, gums, the tongue resting in the mouth, the sides of the mouth, floor, and the roof of the mouth, the back of the mouth. Breathing in and moving attention now to the nose, observing any sensations along the bridge of the nose, the sides, nostrils, sensing any itchiness or tingling. And on the next in-breath, sensing the area of the eyes, the eyebrows, the space between the eyebrows, observing the entire region of the eye, the eyeballs, the eyelids, and breathing in and moving attention now from one temple to the other, scanning the forehead, sensing any sensations here, breathing in and moving attention now to the ears, observing any sensations inside the ear, scanning the ear to the outside, the sides of the head around the ears, now breathing in and moving attention now to the entirety of the face. Breathing in, breathing out, experiencing sensations of breathing in the entirety of the face. And moving attention to the top of the head, observing any sensations in the crown, the scalp, the cranium, the back of the head resting on the floor, perhaps noticing numbness, tingling. Breathing in and experiencing the entirety of the head. And on the next in-breath, expanding the focus of attention to include the entire body. Experiencing the entire back of the body, the front of the body, sides of the body, the arms and the fingers, from the top of the head down to the soles of the feet. Experiencing the incoming and outgoing breath, and scanning the body from the top of the head to the bottom of the feet, and reversing back, experiencing the sensations of the body as they are, breathing with awareness, sensing the bodily presence through our ability to be awake and present to our experience, knowing the language of the sensations of the body, acknowledging the ability to care for yourself by attending consciously moment by moment, experiencing the mind, body, and heart in this way, resting in a gentle awareness that is present for you through the body, laying here in a gentle awareness of the entire body, from the bottom of the feet to the top of the head, just as you are, until you hear the sound of the bells.